Text, UCSF Health. The sun sets over mountains. A man and a woman sit on a porch at dusk.
I've been raised by a bunch of tough old guys, and you don't go to the hospital unless there's a broken bone or there's something seriously going on. If I wouldn't have had Cassie, I would have probably said, I'm not going to deal with this.
Text, Gordon Chatham. Photos show Gordon with his family.
I knew I had mitral valve prolapse from when I was 25. I got diagnosed, but it never affected my life until my wife, over time, felt like it was getting worse.
Gordon, his wife, and 2 adolescent children stand in a kitchen. Text, Cassie Chatham.
It got to the point where I was afraid to lay on his chest because his heart would make a whoosh sound, and then sometimes he would stop hearing it. And those are moments that, you just don't forget that sound because you know it's not right. But he kind of didn't listen to what I was saying for a while, for several years, until I put my foot down and demanded, and then he was like, okay, I'll go.
So I went to a local cardiologist, and he said, yeah, you have mitral valve prolapse, nothing to be too concerned about. Come back and see me in a year. And then in 2021, I got a kidney stone, and I had to get surgery. Part of it was getting a cardiac evaluation to get the surgery. So I went back to the cardiologist, and within those 18 months, my heart got much worse, which was concerning to the cardiologist.
Something he said that scared me is he said, I was asking so many questions, and he said, you're asking the wrong question. And I said, well, what's the right question? And he said, is your husband going to just die of a massive heart attack? And the answer is, it's quite possible.
He said, I'm going to have to crack your chest open and fix your valve. It was just kind of surreal.
Everything changed at that moment.
That was some really big health news that in my life I've never had anything like that. I've never went to the doctor and said, oh, this is pretty serious. This could be life-threatening.
That night was probably the hardest night of my life. How did my husband go from being okay to you need surgery now and I'm cracking open your chest? And we knew that cracking open his chest meant complications that would last a lifetime.
I live in a small community right outside of Redding. It's kind of rural.
Gordon and an older man with a walker sit in armchairs in a clinical waiting room.
There's not a lot of high-tech medical care. I got connected with UCSF because my dad had cancer and he needed a hip replacement. I just remembered how good he was treated, how it affected his outcome. My wife emailed UCSF, and within like 30 minutes, we got a response.
A man in scrubs walks through a hospital ward. Text, Dr. Tobias Deuce, cardiac and transplant surgeon.
If mitral valve regurg does not get treated, the heart slowly but surely will get larger and will get weaker.
A staff member wheels a patient into an operating room.
Here at UCSF, we have one of the largest minimally invasive valve programs. We made minimally invasive the gold standard for isolated mitral valve surgery at UCSF, and the word is spreading further, so we get patients from further away and even out of state. If we tell them, we don't have to open your breastbone, they very quickly jump to, oh, it's minimally invasive. Okay, let's just get it over with.
We're 3.5 to 4 hours from UCSF, which seems like a barrier. But the difference in treatment that I received, in medical care, there's so many amazing things that can be done at an institution that has a lot of resources. I got surgery on Tuesday and I was out on Saturday.
Cassie holds Gordon's hand as he sits in a chair beside his hospital bed.
I was quiet last night, and it was the first time everything was settled, it was dark, and I could just hear my heart, and I never noticed before, but it was different. It just felt strong. I was kind of emotional.
The speed of recovery in these mini incisions is just remarkable. They're usually out of the hospital in 3 to 4 days. If we fix the heart valve, then the blood goes the right direction, and patients can definitely feel within a short amount of time after the surgery that they're more energetic and are not short of breath, and they're happy about that.
It's been 4.5 months since surgery. I feel good. I think my future is great now. My prognosis wouldn't have been as good if it wasn't caught early.
Photos show Gordon, Cassie, and their children in natural settings. Gordon plays ping pong with his son on a front porch.
I am shocked that Gordon is willing to talk about this with anybody. He's very private, but he's so appreciative that he's having an opportunity to tell a story, and maybe it'll help somebody.
My message is, if you feel something's wrong and you feel healthy, it doesn't necessarily mean that everything is good. I think it's really important to listen to signals and not ignore things. I realized it's not just me, but it's my family. It's best to take care of it, give me more time with them.
The family holds hands as they walk down the driveway of their white ranch-style house. Text, UCSF, Health, Redefining Possible,